Patient sits with knee flexed and sole of foot on couch. The transducer is placed longitudinally over the anteromedial aspect of the ankle joint. Tibialis anterior is readily identified as the largest and most medial of the anterior tendons. Tibialis anterior, tibia, and dome of talus with overlying cartilage are visualized. Tibialis anterior may be followed to its insertion on the navicular bone. The patient sits knee flexed and sole of foot on table. The transducer is placed transversely at the level of the malleolus. Having identified the dome of the talus, tibialis anterior is identified as the largest and most medial of the tendons. Laterally, the extensor hallucis longus and extensor digitorum longus tendons are encountered. The patient sits knee flexed with sole of foot on couch. The transducer is placed longitudinally immediately posterior to the lateral malleolus. Skin, subcutaneous fat, peroneus longus and brevis tendons, and fibula are visualized. The patient sits knee flexed with sole of foot on couch. The probe is placed transverse to the long axis of the peroneal tendons, anterior end of probe on the lateral malleolus. Fibula and peroneal tendons are identified. The patient sits knee flexed, sole of foot on couch. The transducer is placed longitudinally immediately posterior to the medial malleolus. The tibia and tibialis posterior tendon are visualized. The patient sits knee flexed, sole of foot on couch. The transducer is placed transversely with the anterior end on the medial malleolus. The tibia and tibialis posterior tendon are visualized. The patient lies prone with foot overhanging the edge of couch. The probe is placed longitudinally on the posterior aspect of the calcaneus. The Achilles tendon insertion is now examined. Achilles tendon and calcaneus are visualized. The retrocalcaneal bursa is hypoechoic, surrounded by fat. By moving the probe proximally, the Achilles tendon may be observed to its musculotendinous junction. The patient lies prone with foot overhanging the end of couch. The probe is placed transversely across the posterior aspect of the calcaneum. Skin, subcutaneous fat, Achilles tendon, and calcaneum are observed. To examine the Achilles tendon, the probe is moved from medial extremity to lateral extremity and panned distally and proximally.